June is Men's Health Month, and to help our fellas, we've headed out to Memorial Hermann Greater Heights Hospital to meet up with Dr. Tojuola, a Memorial Hermann Medical Group urologist. Today, Dr. Tojuola is going to help us get myth-busting some common misunderstandings around men's health.
So the field of urology, we take care of both men and women, but as this is Men's Health Month, we're going to focus on what we do for our men, especially here in our community. So urologists cater a lot for men when it comes to men's health in regards to screening, from such as prostate cancer screening, to talking about urinary issues, kidney stones, and even a lot of different oncologic diseases that can affect men as they age.
So you are the perfect person to maybe bust what could be a myth, and that is, as we age, it's normal to have bladder problems.
And yes, I would agree, that is definitely a myth. Now, with age, these problems do occur, but urinary issues are an indication that something is wrong. And unfortunately, a lot of men assume, yeah, this is normal for me because I'm getting older. However, what I like to educate my patients on is when you're having these urinary issues, you need to be evaluated by a urologist because it could be due to a lot of different disease processes. And these disease processes are things that we can address and fix, right? Is it an enlarged prostate? Do you have scar tissue in your urethra? Is there something growing in your bladder that needs a urologist to address? If you never go in and talk to your doctor, you will never know. So that for sure is a myth. It's not normal with age, happens as we get older, but can be fixed.
Is it a myth that erectile dysfunction is not a major health issue?
That is another myth, a huge myth, and something that I talk to my guys in the clinic about all the time. When they start to have issues with erectile dysfunction, this could be an indication of a variety of underlying health issues, right? We find that a lot of men, especially men that early in life start to deal with ED, may have underlying coronary artery disease issues, right? The vasculature is an issue that usually leads to erectile dysfunction, and men that have issues with it with their genitourinary organs may also have cardiovascular issues. And so we tend to refer those men to see a cardiologist for further evaluation. Another issue that we always worry about in men who have erectile dysfunction is concerns about their hormone issues. Is their testosterone level too low, and may that be affecting their libido? So the myth that ED is not a health issue is definitely one that we need to bust, and one that I educate my men on all the time.
Now, you mentioned hormones. That's something that I, as a woman, I'm like, obviously, I deal with my hormones, obviously, on a monthly basis, all the time. Men, is it a myth that they don't deal with hormones?
That is another big myth. We always commonly assume that women are the only ones that go through hormonal changes in life, but I see a lot of men in my clinic who, as they age, go through issues with hormonal changes, right? Testosterone is that secret juice that keeps us men going, and we find that a lot of men over time just don't produce as much anymore, and that can lead to a wide variety of issues, which, unless we sit down and talk about it, we will never fix it.
Okay, these are some good myths that we're busting. I'm liking it.
Yes.
Here's one that you hear a lot from all people, but particularly men. They just write off that they're feeling tired. So it's like, I'm tired, but that's normal. I work hard. It's normal. Myth or not a myth?
Definitely another myth. Something that every man needs to discuss with their doctors when they go to the office. When you are overly tired and fatigued and starting to lose desire and participating in things on a regular basis, lots of different things could be wrong. And that is another symptom that you need to discuss with your primary care physician or urologist if you have one, right? Fatigue could be an underlying symptom that you're having issues with sleeping. Are we talking about obstructive sleep apnea? Or, like we talked about earlier, are you starting to deal with some of those hormonal changes that occur in men as we age? And those are things that if we sit down and talk about it and assess it properly, we can fix. And another myth that I want to bust is that health screenings are difficult. They are not. I want my men to understand and believe that this is something that you can get done with your physician quickly and efficiently, and doesn't have to take away a lot of your time, but it can be super impactful on your quality of life. And so I'm hoping, as we know that June is Men's Health Month, that every single man out there makes it an important part of their life to get in to see their physician and do a screening visit. And I want every other person out there that has a man in their life to make sure that this month they motivate their men to get in and discuss men's health screening.
All right. Thank you, Mel. Memorial Hermann offers comprehensive healthcare services from preventive screenings to advanced treatments. Their experienced team can help support men at every stage of their lives.
Yeah, to learn more, go to memorialhermann.org/men's health. You can also give them a call at 713-222-CARE. That's 713-222-2273.